day after day, about 100 people decided that they were going to work for Planned Parenthood in the state of Utah. I think that's a grittiness that a lot of people sometimes don't see. They knew that it was likely that they would come to work in a place where there would be protesters out front. And they said, it doesn't matter to me because I know that those patients are counting on me to be there.
I've always wanted to work at Planned Parenthood. I'm very passionate about access to healthcare. I'm very passionate about women's health. I specifically went into nursing wanting to help women because of the lack of access to healthcare for women.
I didn't know that I had access to these services when I was growing up. Coming here and seeing more and more patients that were teens, I felt like there was a purpose for me.
Of the 51 years that I've been a registered nurse, I've worked with Planned Parenthood about 14 years. I'm proud that I can bring the level of experience and expertise and that ability to give the emotional piece to the patients that need it most when they need it. And that's a great reason to be proud to do this work.
You're just getting a different level of care here. People who want to be here, people who are here for a mission, people who want to serve you. But if you're here, it's because you care.
We're just not a health center. We are part of the community. We are part of their family. You know, we understand their needs because some of us have been there before, and I think they always feel like they're in a safe place.
You have a super conservative state. Access to healthcare is more difficult. It could be just society, culture, it could just be religion, it could be your family, it could be your friends. So there's actually still a lot of barriers to especially women's healthcare that are not necessarily anywhere else.
The services in Utah for Planned Parenthood are huge because access is getting smaller and smaller and smaller. It makes me very sad that we had to move out of our rural sites because having worked in rural Utah, those are places that need this kind of care most. I don't want to see people try to self-abort in the ways I saw in the early 70s. It's not a good place for the family to be, and it is not a good place for the community to be.
We provide services for sexually transmitted infection, birth control, manual breast exams, pelvic exams. We provide pap smears for women, cervical screening for cervical cancer, and then some of our clinics do provide vasectomies for patients as well.
When you're working at Planned Parenthood, everything that you do could change this person's life forever. It's gonna make me emotional. Even a pap smear. Somebody comes in for an annual exam and they need just a routine pap smear. And then we catch something, you're preventing cancer for someone. A breast exam, you find a mass, you have literally saved someone's life. They get pregnant and have syphilis, I mean, you're saving their child's life. Everything you do when somebody walks in here is potentially just sending them down a different trajectory. Similar to me when I was just a young person getting birth control, who knows where I would have ended up. For most people, if they don't have Planned Parenthood, there is no option. It's super important, every person that walks in.
What it means to donate to Planned Parenthood, those dollars go to supporting our patient care, to our education, our advocacy, but most centrally to patients, ensuring that they get the care that they need. It gives me so much hope that even in the chaos of this administration, in the chaos that people are feeling in their families, honestly with their checkbooks, that they know they can still rely on us for low or no cost care, that they are able to feel safe in our health clinics, that they know that we're going to do everything that we can to meet them where they are, whether it's language, their background, their sexual experiences, whatever it is, we will meet them where they are and we will treat them with the dignity and respect that everyone deserves because we are Planned Parenthood. That is who we are. It is essential to the work that we do.